Okay, what is your name?
Max.
Okay, Max. Today we're going to do a nutrition focused physical exam. So we're going to be looking for substantial fat loss in certain areas in your body that could potentially show that you have some malnutrition. So what I'm going to do is I'm going to assess you from basically from your head to your feet to see certain areas that have malnutrition. So I'm going to start with looking at some fat on your arms. I'm going to need you to put your arms in a 90-degree angle like this. Okay. And I'm going to pinch the bottom and roll my finger to separate the fat from the skin and the muscle. And it's pretty well cushioned, so you're good in that area. I'm going to assess your clavicle. So I'm going to expose the skin and palpate to where I can feel where your clavicle is, but it has substantial muscle and fat above that. I want you to sit up straight, and I'm checking for muscle in your shoulders and making sure that it rounds and you're good there. I would like you to make an OK signal with your hand. I'm going to check the interosseous. Okay, and it looks like you don't have any real prominent bones showing in your hands, so that's good. Also do the other one as well. Okay, looks good. Looks good to me. I want you to put your fingers out like this, and I'm gonna check to see if you have good circulation in your nails. Basically, if it returns to that pink color after, which it does. So that is good. I need to check your clavicle, so I want you to put your hand out straight. And I want you to kind of lightly push against this. And I'm checking your scapula, so I do feel a lot of muscle there on top of that, so that's good. Now I'm going to check your skin. I want to check your skin to make sure that there's no corkscrew hairs, any rashes. Do you notice anything abnormal with your skin lately? Okay. Looks good. Let's assess this other side. Okay. Looks good. And now we're going to check your scalp. Do you notice anything different in your hair?
No.
Do you notice any hair that's in your pillows or in the shower more recently, more than normal?
No.
Okay. We're assessing for hair loss and any abnormal coloring on the scalp and hair texture as well. Let me see. I think I did. Okay, now we're going to look for edema in your upper extremities. So what I'm going to do is making sure that your skin will return to normal. Okay. We're just palpating to make sure that it will remain normal texture, which it does. And then I'm gonna have you sit on the floor. And then I want to have you sit like with your knee propped up, yeah, and then put that legs out. So just prop one leg. And I need to make sure that you have adequate calf muscle and fat, and you're not any substantial fat loss in that area. And then I want to assess your knees. Will you put both of them down? I want to make sure that there is adequate padding on your bones and you don't have prominent bones showing on your knees, and you're good in that area. And then I also want to assess your quads, so making sure that I don't see any striations or any bones showing on your quadriceps, and you are good in that area. I'd like you to prop your feet up for me. And then I'm going to check for edema and swelling on top of your feet and in your ankles as well. And you don't have any of that. And also, are you right or left-handed?
Right.
Okay, I want you to grab my arm and squeeze. Okay, and you have adequate hand strength grip, so that's good there. Other than that, let me make sure that this is all that I need from you. Yeah. Oh wait, I need to look at your ribs. Show your ribs. So, yes, you have adequate layer over your ribs, and I don't feel boniness. Max, and to conclude the assessment, I'd like to ask you if you've noticed any changes in your overall composition recently, in any fat loss or muscle loss. Have anybody ever commented? Have people been making comments or anything recently about any weight loss? That's a lot.
Yeah, I've been putting on a little bit of weight into my belly, and I've lost a little bit of muscle in my shoulders and arms.
Muscle loss in shoulders and arms. Okay. And then have you noticed any changes in your vision?
No.
Or any like dryness in your eyes, or how have they been excessively like watery, your eyes?
No.
Okay, and then have you had any like difficulties chewing or swallowing lately?
No.
Or experiencing any like pain in your teeth? Or bleeding in your gums?
Yeah, sometimes my gums bleed when I brush.
Okay. And then have you noticed any like sores in your mouth, or do you have a history of like canker sores?
No.
Okay. And has your skin been more dry than usual?
No.
Okay. And then have you noticed any color or changes in your skin?
Just from the sun.
Okay. All right, that concludes our exam. Thank you, sir.